Give it another minute or two. So I guess we'll get started. It's now 4 after. I think virtually all of us are here. We will call the meeting of the Public Health Committee to order. I'm State Representative Jonathan Steinberg, co-chair of the Public Health Committee, here with my co-chair, Senator Mary Abrams. We have a number of bills to raise today, but before we do that, I'd like to invite my co-chair and our ranking members if they'd like to comment. Senator Abrams.
Thank you, Representative Steinberg. I'm Senator Mary Darty Abrams, luckily to co-chair Public Health Committee with Representative Steinberg. I just want to make sure that everyone on the committee, please check your email and make sure you got a webinar invite to the public hearing that will be happening on the 8th and also on the 10th. So if you haven't gotten those, please reach out to our staff at Public Health Committee and make sure that you have those. And with that, I would like to thank publicly Beverly Henry, our administrator, and all of our staff for the incredible job that they're doing. Thank you, Representative Steinberg.
Thank you. Senator Summers, any comment?
No, I'm good. I just hope that people will look to be able to sign up for the public hearings. One thing that I have requested, which has not happened yet, is when you look at the little bill, that there's the link so you're able to click right on the link in the bulletin and be able to get to the sign up. That would make it a lot easier for people. I understand it's the weekend and it's a virtual world, so please keep your eye on the public hearings that are coming up so that you have an opportunity to have your voice be heard. Thank you.
Thank you, Senator. Senator Wong.
Thank you, Mr. Chair. And we're here to raise some bills. And I go back to the statements that I made in the organizational meeting that as we are in the COVID Zoom world, that it is incumbent for us and a duty for us to ensure that we afford every opportunity for transparency and to listen to all shareholders that our role is as legislators to represent. So as we raise through these concepts, I just wanted to share that I would like to be able to get better clarifications on these concepts. And I would offer that there may be some roll call votes on them as well. So because I think we must go and above and beyond to ensure that as we deliberate on these important issues, that we allow all voices to be heard, no matter how long we stay to do it. So I appreciate the opportunity to be part of this process. Thank you, Mr. Chair.
Thank you, Senator. Representative Pettit.
Thank you, Mr. Chairman. Again, just would make a plea for the powers that be in terms of IT. I still think that these agendas and the ability to sign up really should be on the front page on the CGA website under the schedule, as opposed to hoping that our constituents will figure out that they should find out where the bulletin is and then bring up the bulletin and scroll down to the appropriate page to get to the links. It seems like they should be on the front page if we're going to do this all remotely. Other than that, no further comments. Thank you, Mr. Chair.
It's a good point. Thank you for that, Representative. We will look at it again. We want to make it as easy as possible for people to sign up.
Mr. Chair, I forgot one thing, if I may.
Senator Summers.
Yes, there has been a request from actually multiple people and some staff that when we have our meetings, could we make sure that it's on gallery view so people can see all the people that are in attendance? I guess it's really hard if you're watching the Zoom to not have it on gallery view so that they can't see all the reps that are there and that are speaking. So it's just a request, and I think it's an easy one to be able to accommodate.
I'm not sure I understand what you're asking.
When people are watching the Zoom at home, or, you know, staff may be watching, if you have your computer on, not on gallery view, then they can't see everybody who's attending the meeting. You can only see the person that's speaking. And people have requested that they are able to see everyone, not just the person that's speaking. And that would be gallery view on the Zoom versus speaker view.
Just to be clear, it's not possible to get everyone necessarily.
Right, but
on
you
one
can
screen.
see, you know, more than just one person's, you know, like right now I'm looking at, I don't have it on the right. So I can see you, and then I see just like 4 people at the top. So I need to switch mine to
You
gallery.
need to model the right behavior, Senator.
So now I switched to gallery view and I can see 30 people. And I think the people watching have requested, I think they want to see that their rep is there or is present, so to speak, rather than just seeing the person that is speaking. So that's a request, whether you want to honor it or not. It has come to me from both staff and the public. So
I understand that may be something we'll have to look at. It may not be consistent with the rules that have been agreed to, but we will definitely investigate and get back to you on that.
if you hit your gallery view in the right hand, everybody can see all of the reps and senators.
We understand, but we're just going to have to check whether that's something that we're allowed to do. There is not certainty at this juncture whether that is something we are allowed to do. So we're going to have to get back to you.
Because we have that in other committee hearings where everybody's on gallery view, just so you can see who's speaking. I can see how that would be very frustrating for people if they're watching a Zoom and they can only see 4 people in the committee hearing and the speaker. So
I think ideally it would be like we have in a committee room where you can see everybody around the table. That'd be ideal. I'm just saying that we'll need to confirm that with you. All righty. Any other comments before we start with the agenda for raised bills today? If not, let's get started. We have concepts to be raised. Items 1 through 4, an act concerning immunizations, an act authorizing the administration of vaccines to children at pharmacies, an act concerning mental health and behavioral health services, an act concerning physician assistant scope of practice. Do I have a motion to raise bills numbered 1 through 4?
So moved.
Second, Senator Moore, second.
Moved and seconded. Any comments before we have a vote? If not, we will engage in Senator Wong.
Thank you, Mr. Chair. And as I stated in the opening, these are concepts to be raised, so there are no language attached to it. I understand that, but could the good chair explain on item number 1, an act concerning immunization? What is it related to? Immunization? Is it related to vaccine exemptions? Does it have to do with religious exemptions? Could the good chair elaborate a little bit more in regards to what we're looking to raise in this concept and what area are they looking to address?
Thank you for the question, Senator. This bill is named exactly, I believe, the same as the bill was last year. And that also reflects that the bill is substantially, if not virtually totally, the same as last year's bill, and everybody's in a position to at least review that. As we've stated, we've made one change to the grandfathering to begin that at seventh grade and above. But the rest of the bill is the same, at least for the purposes of this public hearing. And we will have language for people shortly just to confirm that. Now, if you want some specifics for those who are maybe new to the committee, this bill does two significant things. It clarifies and strengthens the path for families to obtain a medical exemption and provides oversight to make sure that if this bill becomes law, it's implemented appropriately and we get to provide oversight. And the other thing it does, it removes the religious exemption for vaccines. So it has those two key elements, focusing on the medical exemption and removing the religious exemption. There are a number of other features to the bill, but those are the primary ones which I think people are interested in. We could elaborate further, but as I said, this bill is virtually the same as last year's. That bill is available to the public and to members of this committee. And there are really no substantive changes to bring up.
Thank you, Mr. Chair, for that clarification. And again, I remember the last previous meetings we had in relation to the religious exemption on vaccine issue, and the good chairs were recognizing the transparency and pushed off the approval till right now. So I do want to point out that, as you shared it, if it is indeed the same bill as was raised and had the details, not having it as a link for people to be informed about it is why I wanted to pose the question. I did want to point that out. The second part is, will this be a House bill or a Senate bill?
We have raised a House bill under the title of immunizations. There is a related Senate bill, which is about removing non-medical exemptions. So the two are related. Conceivably, they may end up being similar, but it's only likely that one would move forward at some juncture. I also want to remind everyone that there is a companion bill to this that we have already raised with regard to reimbursement for a consultation between families and practitioners with regard to vaccines. So that these are the elements that we have going forward to allow us to manage the processing of the bill. But the bill that we're raising today, we fully expect will be the bill that we will vote on in committee.
Thank you. And I'm eager to hear other people's perspective and inquiries about this. And as we do, I would like to ask for a roll call vote on this concept bill.
Certainly, we will grant that. Any other questions, Senator?
No, I thank you for your time. And as I say, we have a responsibility to be very vigilant in ensuring that we focus on addressing the issues and getting all shareholders' perspectives. And it may take some time, but that's what we're here to do. So I'm eager to be part of that process. Thank you, Mr. Chair.
Well, I'm as eager as you are to accommodate as well as our ability, all stakeholders who are interested in speaking. Senator Summers. Can't hear you, Senator. There you go.
Okay. Can you guys please clarify the difference between the two bills? Because I'm not clear. One's an act concerning immunizations, and the second one is an act concerning the non-medical exemption. And I'm not really sure if they're the same thing, why we're raising the two bills in both a Senate bill and a House bill. Could you please explain that to me so I'm clear?
Well, I would say at this juncture that's a difference in search of a distinction. At this point, there are not differences. The bill that we're raising today is the vessel for the purpose of the public hearing. At some juncture, we may decide with which bill to go forward, but speaking for myself, I expect that whichever it is, the House bill or the Senate bill, it will be substantially what we're talking about in the public hearing.
So just to be clear, you're saying that the act concerning the non-medical exemption would be folded into this act concerning immunizations. We would have one bill coming out of committee.
Yes, there would only be one bill coming out of committee, most likely, unless there are unforeseen circumstances. We're at an early part of the process, Senator. We haven't even had a public hearing yet. We want
No,
to.
I'm
Can I
not
just add to
clear. I
that?
just wanted to be clear because people are confused why there's two different bills with the same title. One's a Senate bill, one's a House bill, and also not having the language if it's the same, except for the grandfathering is now starting at a different grade level. That I feel like we should have the language available right here with a quick link so that people can see it. But I just wanted to know the distinction between the two, just so that we're clear, because it's confusing for people. For some reps and also for some people in the public as to what's actually in each bill. So I just wanted to be clear. That makes sense if you want to raise them like we're doing with other bills and put them into one bill, that makes sense, just so there's clarity.
I just want to speak to that, since the proposed bill that you're referring to is a bill that I proposed. The intention is to hear them both on the same day. I think that the bill that I proposed is clear. There's not more to it than that at this point, just about removing any non-medical exemptions. I put it that way on purpose because although currently we have a religious exemption in our language, there are other states that use philosophical, for instance, as an exemption. And I wanted to be clear that the purpose would be to only have medical exemptions when it comes to the immunization requirements. So I was trying to be as transparent as possible. But there is nothing more than that. We will hear them both and we will work on them together and we will see how it moves forward.
Okay, thank you for that clarification. The only, of course, I'm just going to have to state for the record, I do have an issue with the title of the non-medical exemption. I understand what you're trying to do, but really what the bill does is it takes away a religious exemption. There is nothing in Connecticut statute that is a non-medical exemption. It's called a religious exemption. So for clarity, I wish that the title had said that, but we've already had that conversation. I just want to say that for the record. Thank you.
Thank you, Senator. Representative Zupkis.
Thank you. I didn't know how to take my hand down because Senator Summers asked my question. I too, to have two bills, the same bills, on that hearing, thank goodness they're going to be heard on the same day. And I do hope that everybody who wants to speak, no matter how long it takes, is able to be heard. And I do believe it's confusing, and I want to also be as transparent to the public as we should and ought to be, and that they deserve us to be. So thank you.
Well, thank you, Representatives. As I said, the bill will be ready for viewing by the public shortly. There will be over a week between that point and the time in which the public hearing will happen. They'll afford people lots of times to review the bill, to send in questions, express their opinions, as we've always done in the past. Representative Claritas Detria.
Thank you, Mr. Chair. My first question, why the change in the age to 7th grade for the grandfathering in when last year there was no age limit?
Thank you for the question. It was the chair's decision in consulting with others and looking at the data that there was less of an issue with vaccination rates in the middle and high school, and that the emerging trend of below compliance levels in schools was taking place at the elementary school level. So we chose to follow the data and tailor the grandfathering to address the problem that the bill intends to address.
Okay, thank you. And I wish it was considered at some point to do an education campaign to increase vaccinations for people instead of doing this such a controversial bill during our Zoom meetings. And to echo my other members, I think it's important that we do not limit our testimony to 24 hours because we will be shutting out people that won't be able to testify. And we would never, considered this if we were in person years past. We've never shut down or shut off a limit or put a limit on our public hearing testimony. So I don't think it's fair to be able to do that now, especially during COVID, because this is a very important bill to a lot of people and they need to be heard. Thank you.
Thank
Mr.
you,
Chair.
Representative. I'm not sure that's true. I'd have to go back and look at the history. I do believe that pre-Zoom, there have been hearings that have had cutoff times. So I'm not sure that's factual, but we will look into that.
Thank you.
Representative Dauphiné.
Thank you, Mr. Chair. Mr. Chair, with regard to expanding medical exemptions, what conditions and specifications will that include?
It is somewhat enumerated in the bill from last year and the bill for this year. It does refer to autoimmune. I think the chairs would welcome any suggestions that would make that even clearer and stronger. That is certainly in our intent. Obviously, it does afford the majority of the discretion to the practitioner to come to conclusions about whether or not a medical exemption is appropriate. Certainly something that we hope to establish in terms of legislative intent is the expectation that a practitioner, in consultation with the family, may choose to offer a medical exemption that amounts to some adaptation of the required vaccination schedule so as to afford a child an appropriate path to immunization and compliance, so that if there's something else going on in the household or there's some reason to postpone a particular shot or even conceivably not take a certain shot, that's taken into account. That would still fall under the medical exemption. We do hope this will be some of the conversation we'll have in the public hearing and in subsequent conversations with the committee. But thank you for the question, because we do want to put as much focus as possible as to the changes to the medical exemption, which we feel is a key feature of this bill.
And Mr. Chair, does this mean that we are going to encourage doctors to operate outside the CDC recommendations?
To be clear, the CDC recommendations influence what the Department of Public Health chooses to put into the schedule. The practitioners obviously follow DPH's requirements. But I can't say that in every instance what CDC may offer by way of guidelines in terms of recommendations as contrasted with requirements is necessarily picked up by Connecticut. Our state tends to follow CDC guidelines and certainly follows requirements, but we invest DPH with that decision-making capability, and practitioners follow those rules.
You know, I just wanted to make a comment that many of the medical providers feel very intimidated by giving out medical exemptions with regard to what's going on. And I just wanted to say that, but I'm vehemently opposed and will vote no. This bill really has little or no language to it, so we really don't know what is going to be the outcome of it. But thank you for your time.
Well, the chairs have tried to demonstrate that you can become very familiar with this bill, and I recognize you're new to the committee by looking at last year's bill. We are raising a bill today. The language will be available shortly, but there should be no lack of clarity about what the bill is about if one looks at last year's bill. So I'm not sure I understand why you say that you don't know anything about it. We have tried on several occasions to make it clear that you can acquaint yourself with the specifics of the bill.
Well, and just one other thing I wanted to repeat or support what Representative Claire just said about limiting our constituents with regard to the hearing time. I've had dozens and dozens of individuals contact me, and they are very, very upset that they may not have the opportunity to come before this committee and speak.
Well, I will comment briefly on that. I'm on record as saying that it had been my intention and hope that everybody would have an opportunity to testify. We were advised that an indefinite period that could last days and days might be impractical. We've imposed a time limit, which is longer than any other committee has ever imposed a time limit. And I should note, longer than even last year's hearing. But most importantly, every citizen of the state of Connecticut is afforded an opportunity to testify and can do so in writing, as we've always made available in the past. So we are not closing any door to testimony. We are trying to simply impose what have been deemed reasonable limits on a public hearing in the state of Connecticut. And I will add, in many other states, they don't even afford that much leeway in this context.
Well, I would just add that, you know, it's hard enough that the people are not able to come to the people's house and be heard. And now we're going to this virtual setting, and they still want to be heard. We've always allowed our residents of Connecticut to be heard. And I just think that there's no excuse not to allow them to be heard. Thank you.
Representative Carpino.
Thank you, Mr. Chairman. Just a few comments, and I don't want to belabor the point. These 22 and a half hours we spent all together last year during this hearing was important to everybody who was heard. But we finished on Thursday morning, and it seemed that just the day later, we had a bill in front of us, and it was a bit of fast pitch. And I thought that was very disrespectful to the individuals who took the time to testify in writing and before us. So I would hope that the committee does not engage in fast pitch on this important topic again, particularly when we are going to have these, and I'll say it, unfair limits to folks speaking their mind and sharing their perspectives with us. So I hope the committee leadership really thinks about how we're going to proceed. I'd also ask that that rule be shared. The 24-hour limit is new to me after being here a decade. I take you at your word, but trust but verify has always been one of my mantras. So I'd love to see that rule if perhaps the committee clerk or LCO could send that along to everybody.
I should clarify, this is not a rule for the General Assembly. This is a decision by the chairs to impose what we believe is a reasonable time limit based upon practicalities. And as I've stated, my initial intention was to assure everybody we are trying to behave reasonably and afford more than one means by which people can indicate their comments and points of view. That's where we are right now.
I respect you for taking ownership of that decision, but I'm very disappointed by that decision. We have so many people who want to testify on both sides of this issue. And my fear, and it has been echoed in this committee before, is that our Connecticut residents are going to get perhaps overshadowed by so many people outside of Connecticut that want to testify, and I don't think that's going to be fair. And my last point is we've heard a lot, and a lot has changed in Connecticut since we heard this bill last year. The goal stated is to improve the public health of our children and to keep them safe in school. And many of our children have lost the opportunity to go to school in a meaningful manner in this past year. And you and I have discussed this, sir. So I would hope that there are changes to this bill, whether I vote for it or not. I'm in the minority. I wish we weren't hearing it, but I recognize my status in this building means that in the minority, the bills I don't want to heard doesn't necessarily change the outcome. But I would hope that the committee leadership takes a look at things that weren't discussed last year, whether it is remote learning, if you so choose to keep children out of school, whether it is other opportunities to keep these parents engaged, whether it is educational opportunities. I find it difficult to know that we're having this conversation when we haven't even seen the most recent vaccination rates. And my last point is, I appreciate you stating that this is going to be similar to last year's, but Senator Abrams, I appreciate your transparency, but I'm going to vote no on that Senate bill because I think it is only further confusing the public. If we are talking about the same concepts as last year, we shouldn't have two different vehicles with two very different titles. Thank you, sir.
Thank you, Representative. And I agree with you. The entire reason for the process that we follow as legislators is to not only have a public hearing, but to hear ideas, changes, adaptations to the bill. The bill changed a little bit last year. I would be surprised, I'd be shocked, frankly, if it doesn't change somewhat this year. And we want to have that process. And if the impression was it was fast-pitched, or I'm not sure what your phrase was last year, we will afford enough days between the public hearing and bringing it before to the committee to assure everybody have a chance to have a conversation. I'm not sure how many days that constitutes, but that will be our intent. Representative Pettit.
Thank you, Mr. Chairman. I've been asked a question by a number of folks in our caucus as well as other legislators, and that is whether we would consider dividing the public hearing, that is, say, a day one going from 9 a.m. to midnight, 15 hours, and then breaking to continue the next day. I would readily admit on last year, year and a half ago, 22.5-hour hearing between 2 a.m. and 7 a.m. I probably was not at my mentally sharpest in terms of taking in the testimony that occurred. So that was a suggestion or a question that was asked, and I wanted to pose it to leadership. Thank you, sir.
Thank you, Representative. We'll have to look into that. I would bet that that's probably not allowed by the rules. And I should clarify a comment that Representative Carpino made. The 24-hour limit is not in the rules. The rules are not clear on that point. This is a decision by the chairs based upon advice that we put a reasonable limit on testimony, since the written testimony is always an option, rather than, as Representative Carpino mentioned, perhaps spending much of our time listening to people who are not residents of the state and whose intent is basically to extend the hearing without necessarily reflecting the views of the people of Connecticut. So to your point, Representative Pettit, we will look up to see if that is indeed possible. I don't think any of us were at our freshest at 2 or 3 a.m. I can only imagine what would that be like had we allowed this to be indefinite, and on the third day, what we might be feeling like. Or it would probably be better that we do it by Zoom, because we may not be people we would want to hang around with in person at that juncture. But we will look into that and get back to you. Thank you, Representative. Representative Terciak.
Thank you very much. A little trouble unmuting there.
Do you have a guest that you're introducing today?
I wasn't going to introduce her, but this is Kemba, who we're very fond of in the house. But anyhow, to get back to the never-ending discussion about access and being able to communicate with our committee, it was brought up enough again today that I just felt that I should pass on comments from some of my constituents who want to know why everybody seems to have forgotten about seniors. We're one of the oldest states in the nation, and we have traditionally had our public hearings after dark, when many of us who are seniors do not feel that we're at our best on the road. So the idea that it's always been perfect and able to communicate with the committee doesn't ring true with the seniors in my district, because they know that's not true. What we are doing now and opening up an even new way to communicate with the committee, everything we had before, plus Zoom, is an improvement. And even for the folks who say they would have to have their grandchildren set it up so they can participate by Zoom, I get thanks for improving our access, and cannot remind enough, if you're having meetings after dark and expecting people to come to Hartford, you might as well be sending every senior a postcard saying, here's what we're going to do, and you're not really expected to come. Thank you, Mr. Chairman.
Thank you, Representative. I should note that we will be starting this hearing at 9 a.m. when we should all be very fresh. Representative Gilchrist.
Thank you, Mr. Chair. I too felt compelled to speak about access. We're in uncharted times in a pandemic, and so I applaud all of the leadership for thinking through innovative ways that we can continue to have our legislative process. In years past, I've heard from students, citizens. I was an advocate for years that the process we had in place was very challenging. You'd have to come to the building first thing, attempt to beat people into a line so that you could get a good spot for the hearing, and then be expected to wait around all day. Although I was not on this committee, I'm hearing from you all, it lasted 22 hours, and I remember being in the building and walking past and even having to politely step over families who were waiting around all day long. Folks have personal responsibilities, they have work responsibilities, and waiting at the Legislative Office Building in Hartford isn't possible for many. And so I do think that this process affords others an opportunity to participate in the process like they weren't able to before. Even our new sign-up process, I think, is a positive. And then I'll echo what you said, Mr. Chair, that if folks still cannot participate, like they weren't able to participate in person, they can submit written testimony. And I know that when a bill makes it to the floor and I wasn't on that committee, I certainly look at all of that written testimony to understand the various perspectives. So I do want folks to know that we are listening and we will hear their point of view. Thank you.
Thank you, Representative. Representative D'Amico.
Thank you, Mr. Chair. I just wanted to, since we're taking a trip down memory lane today, just wanted to clarify something for the committee in reference to my friend Representative Carpino with regards to last year's situation. My recollection is that we had the public hearing on the bill 5044 on a Wednesday. And then we had the committee meeting where we debated extensively and finally took a vote the following Monday. So I would submit that intervening 5-day period gave us plenty of time to talk to our constituents, to talk to each other, to debate the merits of the bill. I certainly had many important and lengthy conversations with constituents. So I just for the record, I don't think it was rushed at all. There was a 5-day period between the public hearing and the actual day of the vote. So anyhow, just wanted to put in that reminder. Thank you, Mr. Chair.
Thank you, Representative. Representative Cook.
Thank you, Mr. Chairman. I just have a clarification on process. So I believe that we had a bill that was in the motion of being raised and voted on, but we are now discussing our process and committee hearing procedures. And I don't think that necessarily falls in line with the responsibilities of where we are. So I would make a motion that we go back to what we need to talk about. And then if we want to debate the process, whether it be 24 hours, 48 hours, or 2 weeks, I think that we need to do that after we go through the procedures of what is actually on our agenda.
Thank you, Representative. I am properly chastised for being too lenient about the subject matter, though I will say that a number of representatives and senators have spoken to the specifics of the bill, and we want to afford them that chance. So if you'll humor me, I will just go to Senator Summers for the second time.
Just quickly, I would just like to point out that it is frustrating for especially new committee members. If this is the same bill as it was last year, we should have the language available. And that is frustrating. And also, I respect the chairs, but I do not agree with the decision to limit the time. We can argue the merits of Zoom or not Zoom. I think Zoom gives access to some. Clearly, not everyone knows how to use Zoom. We're debating over gallery views, et cetera here. But I think limiting the time to 24 hours really sets a bad precedent for people that want to testify on this bill. And this is an emotional bill. It is a bill that obviously you heard drew a lot of people out. And if we're going to hear this bill, I really feel that we should give them the ability to come by Zoom and have their voice be heard as they want it to be heard. I'm willing.
Thank you, Senator. You made that clear now for the second time. We hear you loud and clear. Representative Zupkis.
Thank you, Mr. Chair, for the second time. I'm not going to reiterate. I do agree with my colleagues. I will ask that, well, first of all, I'm going to vote no on this because I think that the two bills are the same. One bill in a public hearing is fine. And as we all know, a piece of legislation comes before us and it has always changed and tweaked and all of that. So I personally think having one bill is sufficient. But I would ask on the hearing process that if it is going to be limited, which the chairs have decided to do, that any elected officials or commissioners are not included in that time. I feel they should be last. The public should be heard first, but they should not be, if it's 24 hours, 48, 5, whatever it is, the time of elected officials and commissioners should not be put into that time frame, because as we know, we can talk to commissioners for 3 hours, and that is not fair to the public. So thank you for that consideration.
Well, thank you for that. We have honored the tradition that we're afforded in other committees to have public officials for the first hour. But to your point, we will limit the conversation, the comments of anybody testifying, whether a public official or otherwise, such that we can get the maximum number of people an opportunity to testify. Seeing no other, Representative McCarty, excuse me.
Yes. Thank you very much, Mr. Chair, and for this opportunity to make a comment. First, I'm not going to talk about the process. I've heard all the comments and agree that it would be ideal if we had a different process in place. But my objection is really coming to the point that I know we're all concerned about school safety, and that's really the mission here, and that we understand that vaccination has eradicated many serious diseases. My issue with raising it at this time is the urgency of the bill. We looked at the data last year. I know there was flaws in the data, and that I believe that we should have new data to look to see what we can possibly do to bring up the herd immunity rate throughout the school districts. I believe with the proper education, we could do that. So my objection really is more with timing and not with the safety and efficacy of vaccinations. I think we could accomplish the same goal with more time. So I will say today, I'm disappointed that it's there, but I also appreciate your comments, Mr. Chairman, that as we go through the process, we may be able to find some alternative methods that we could accommodate all those other areas that we've spoken about. So unfortunately, I will be a no because of the timing of the bill. So thank you for allowing me to express my concerns.
Thank you, Representative. And I do want to address the comment you just made. I think we all believe that more data is always good, particularly if it's accurate data that we have great faith in. Unfortunately, because of the pandemic, if we even had the past year's data, it would be anomalous, and it would indicate that huge numbers of schools would fail to be in compliance because children had not had the opportunity to get their vaccinations in the past year. So even if we had that data, it would not necessarily be particularly informative. It would be anomalous. It would not be as useful as we like. This is a problem for us. 2020 will not be data we can really use to assess trends. And 2021 will be compromised as well. But I will say that the reason this bill was raised last year and it has been discussed for several years is because what many of us believe is the alarming trend at the elementary school level where the vaccination rates are falling. So, if we were to use data, if we had it, it would indicate they're collapsing, but that would not be a reasonable use of that data.
Well, if I may, thank you for those comments, but I may argue that some of the data that we did receive was also flawed, and that I do believe that with the appropriate education within our school districts, that we could raise those immunity rates up, the herd immunity, so that we would accomplish what we all want to do, and that's the safety of our school students in school. But we could also preserve a small percentage because we're in a 98% compliance in the state. But I understand this is not the time to debate the merit, and I just wanted to express my concern. So thank you very much.
Well, thank you, Representative. And I think we should have a further conversation about education. And I mean education also in the context of educating people about vaccines. So there's a lot to discuss, and that's part of our process. Senator Wong for the second time.
Thank you, Mr. Chair, for the indulgence of the second time. I just want to make a point of clarification that, as I repeat over and over again, we're living in unusual times. And that's why I think it's really important for us to be clear and to not create any bit of confusion. So I see when we have two potentially identical bills with different bill numbers going into the House and the Senate, when so many of the advocates have been focused on Senate Bill 568. We, in creating a separate bill, may be convenient for the committee leadership, but it creates confusion in a time where people have limited access to really what's happening in Hartford. And I would say, for anybody who doesn't trust government, it's just another example of creating a misdirection, rightly or wrongly. And I want to point that out, that if truly we are focused on transparency, let us focus on one bill, Senate Bill 568, and not create any other vehicles but obviously that's not the route we're going. But I also want to close by simply saying this. The chairman did say that people will not be denied an opportunity to offer their views by written testimony. What we forget to mention is an emotional, authentic testimony in person could never, ever be substituted in the importance of our democracy. So to say that we can substitute with something in writing defeats the purpose of us having this Zoom meeting and operating democracy and respecting the authenticity and the emotions of people feeling passionate about this viewpoint or any other viewpoint. So we cannot discount and say you got your say when you really feel as though you're not getting your say. So I appreciate the second time in raising it, and I know we're beating it to a point, but nevertheless, democracy is very important to protect and preserve. So thank you, Mr. Chair.
Well, thank you, Senator. I'm beginning to think we need to impose a 24-hour limit on this discussion. I would argue that we've always had the issue with written testimony, and I would bet that many people who have submitted written testimony would have preferred to do it in person, but that's the way it's always been, and it's the obligation of legislators to make sure that they read the written testimony as well. Representative Dauphiné for the second time.
Thank you, Mr. Chairman. Could you just please clarify, will everybody be getting 3 minutes, or is that time frame under consideration as well?
No, 3 minutes has been the rule and will remain the rule, and we will seek to enforce it gently but firmly, in the sense that if we can stick to that 3 minutes, we will get to more people.
And could you just please clarify, weren't the legislators supposed to go at the very end per the House rules that were put out?
That is not, I'm not aware of that. Again, we can look into that, but that's the first I've heard.
Thank you.
All right, seeing there are no further comments, I will have to go back to those who've moved and seconded the bill. If I believe we're going to remove item 1 from that. Are you prepared to withdraw your motions?
I'll withdraw my motion.
And the second? All right, who seconded? Come on now.
Senator Moore. Senator Moore, second.
No, Senator Moore, we'd ask you actually to retract your second.
Retracting my second.
All right, so I'd like to consider a new motion for items 2, 3, and 4 to be moved to be raised bills.
So moved.
Do we have a second? It's your chance, Senator Moore. Okay.
Are you doing it, Senator Abrams?
Senator Abrams, second. Thank you.
I am willing to go forward with a voice vote unless there are objections. Please turn on your cameras and unmute yourselves.
Chair, a voice vote on which bills, if I may?
The motion was for items 2, 3, and 4.
Okay.
I guess we're all visual. All those in favor of raising bills 2, 3, and 4, please indicate by saying aye.
Aye.
Are there any opposed? Oh, those opposed? Any abstentions? If not, we can move on to the next item in our agenda. I guess actually, since we're still on that item, we should go forward with a vote on the first item, an act concerning immunizations. The request has been that we take this vote by roll. Do I have a motion?
Motion, Senator Moore.
Do I have a second?
Second.
Second.
Gilchrist.
On 1.
All righty. Any further comments before we move to the roll call? Again, I would ask you to activate your cameras and be prepared to respond when the administrator asks for your vote. Madam Administrator, please proceed.
Senator Darty Abrams.
Senator Darty Abrams votes yes.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar. Senator Kushner. Representative Gilchrist,
Senator, I'm sorry, I had trouble unmuting, but Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
I don't know if Senator Anwar votes yes. I think the internet is frozen.
thank you. Senator Wong,
Senator Huang votes no.
Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givalio,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Senator Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Rep. Elliott votes yes.
Representative Elliott, I did not see you on screen, please.
I should be here. I see myself.
Thank you. Representative Foster,
Representative Foster votes yes.
Representative Django, Representative Green,
Representative Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Senator Casa, Representative Cabras DeGraw,
Representative Cabros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Lenahan,
Representative Linehan votes yes.
I never knew that.
I know.
Representative Moore, McCarthy, sorry,
Representative McCarty votes no.
Senator Moore, Senator Moore votes yes. I'm sorry, Senator Moore, I did not see you on screen.
I see me.
Hi,
I see me. Senator Moore votes yes.
thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
thank you.
Representative Jenga votes yes. Madam Administrator.
Thank you, Representative Chandra.
Beverly, I realized I voted, but I was on mute, but I voted yes, Representative Ryan.
Him too.
May I ask a question of the chair?
Representative Steinberg, I think you were talking about, you were on mute.
I was on mute, so
Okay.
I don't know how I got on mute, but it just happened. So let me start again
I
from the
just wanted,
beginning.
I just wanted to ask a question whether the vote would be held open for folks who haven't had a chance to vote.
That's what I thought I had said, but clearly no one heard it, so it doesn't really count. I want to make it clear that all votes will be held open from an hour post the conclusion of our conversation today. So we will be holding votes open for 1 hour. I'm glad I had a chance to repeat it so it actually appears in the record. And then I was referring to item 4 of the agenda, which I don't know if anybody heard that either. So let's try again. Proposed bill will be reserved for subject matter public hearing. Proposed Senate Bill 568, an act eliminating the non-medical exemption to the immunization requirement. We have discussed this bill previously. Do I have a motion?
Senator Moore makes a motion.
Do we have a second?
Second.
We have a motion and a second. Open it up for comment on this bill. Representative Dauphiné.
Thank you, Mr. Chairman. I'm just wondering if you could explain to me what non-medical exemption means, because we do not currently have non-medical exemption.
Well, it's not the phrase that is used in statute, to be sure, but I would submit we do have a non-medical exemption because a medical exemption is medical, and any other exemption one is afforded is by definition non-medical. So one could easily accurately describe the existing religious exemption as a non-medical exemption. Is there anything else, Representative?
No, I guess I would take umbrage with your statement. I mean, it's religious freedom and religious exemption, not non-medical, but your explanation is noted.
And I'm sorry if you feel the need to take umbrage. I'm surprised that one would take umbrage about the use of a term, but that is certainly your prerogative. Are there any other questions? If not, we may move forward to a vote. If there are no objections, we will take a voice vote.
Excuse me, Mr. Chair.
I recognize Senator Wong, followed by Senator Summers.
Thank you, Mr. Chair, and we don't want to belabor the point. We've talked about it already, but I would like to have a roll call vote on this agenda item.
Not surprising. Thank you, Senator.
Thank you.
Any other
Want to
comments?
Be consistent.
We do admire your consistency, sir. Any other comments or questions? If not, we will move to a roll call vote. If Madam Administrator is ready to go, I again advise you to activate your cameras and make sure you're ready to respond when asked. Madam Administrator.
Senator Darty Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar, Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang votes no.
Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
I think my internet froze again. Senator Anwar votes yes. I'm so sorry.
Representative Elliott, Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes. Did you hear me?
Yes, I did.
Thank you.
Representative Green,
Representative Green votes no.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Pablos DeGraw,
Representative Cabros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak, Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
The ESSER II funds layout that.
Representative Terziak,
Representative Terziak votes yes. Thank you.
It's important for you to look at those numbers.
Representative Elliott,
Are there any other members of the committee who have not been afforded an opportunity to register their vote? To remind everyone, the votes will be held open for an hour upon our ceasing to have a conversation. So anybody who has not yet had a chance to vote, we will encourage them to do so. We will now move on to the next section of today's agenda. Section 5, proposed bills to be drafted as committee bills. There are two items: proposed Senate Bill 238, an act increasing oversight of mergers and acquisitions of group practices, and proposed Senate Bill 683, an act concerning hospital billing and collection efforts by hospitals and collection agents. I seek a motion to draft these proposed bills, items 1 and 2. Do I have a motion?
So moved by Cook.
Second,
Yes.
Abrams.
Seconded by Abrams. Are there questions or comments with regard to these two bills? Senator Summers.
Yes, it's my recollection that during screening, we talked about these bills, and these were bills that, especially on the collection bill, we were going to not hear in this session. Can you share what's changed? And also on the mergers and acquisitions, we had a discussion about that was really, it had to do with CON and some other issues. Can the chairs explain what happened? The rankings were surprised to see this on the agenda.
I do not recall the conversations precisely as the senator has described them. I'll defer to Senator Abrams if she'd like to comment.
Sure. I don't recall that conversation being that way either. I was going to check with the proponent of the bill, which is Senator Mooney in both of these cases. And we spoke, and the chair, Representative Sundberg, and I spoke and agreed to vote to draft these bills. So both of them are, I think, consumer friendly. I think that the first bill, is just to really look at and since it isn't drafted, we'll have more information once it is, to look at oversight of mergers and acquisitions of group practices, because we have some language for it now, but we're not sure that it's meeting the needs of what's happening in our state in terms of how practices are being bought up. And the second bill really looks at the collection, the amount a hospital or collection agency can recover from patients for unpaid hospital bills, and also to look at the manner in which they're collected. There was other legislation that came up that was proposed along these lines as well. So we felt that it was worthy of fleshing out and drafting into a committee bill.
Right, I remember, I think Senator Anwar had a similar bill, and I remember the conversation that we all agreed that, yes, there was something that, this is something that we need to look at. We talked about what hospitals do in sometimes predatory fashion to individuals, but I thought that we had agreed to not hear this session because of our bandwidth. Maybe I was mistaken. I think my other rankings remember it that way too. So I was just curious how that happened. Thank you.
Thank you, Senator. Representative Zupkis.
Thank you. Thank you, Mr. Chair. I just have a question. Both of these have not had a public hearing. Is that correct?
To my knowledge, I do not recall having these subjects discussed previously. I could be wrong, but they don't ring a bell.
So if they're being drafted, will there be a public hearing on these? Because as Senator Daugherty Abrams just stated, you know, we're not meeting the needs in the state. How do we know? What do we know we're not meeting? How do we know what we're not meeting? And I think it's important and contingent on us to hear from the agencies, the departments, the hospitals, individuals on flushing these out and how do we make it better. I'm not saying I'm for or against them, because quite honestly, I don't know enough about them. But I think the process is that they go through a public hearing. Will that happen?
Of course, Representative, that is our process.
Great.
This is what we're actually raising and drafting bills so that we can go to a public hearing and learn more and maybe make them even better.
Thank you. Maybe I was confused. I thought we have the public hearing, then they're drafted. That was my question.
You know, it is a good point. And I think sometimes we all get a little confused about raised and drafted and which has language and which doesn't. What I really want to impress upon the public is that everything gets a public hearing once we raise or draft a bill. And that is an opportunity for us to learn more and discuss more. And that is still not the last stage. We still discuss the bills before we vote them out. So that is our process. And for the most part, it works pretty well for us.
Great. Thank you. I just wanted to make sure. Thank you.
Representative Pettit.
Thank you, Mr. Chair. What I recall from Senator Summers' comments was that we were going to check with the proponent and then discuss these again. But be that as may, I'm wondering if 238 may be better for general law and other committee, and the billing practices might be more appropriate for insurance. So I'm not sure they're completely in the bailiwick of public health. So I don't know if that's I guess that's a comment and a question.
You know, I agree with you. There's a good chance that if we should pass these bills, they may end up also being considered by other committees. This happens all the time, including the bill that we have with regard to reimbursement for consultations on the vaccines. We fully expect that to end up in insurance before it reaches the floor, just part of our process. I will say, though, that both these bills touch considerably on healthcare in the state of Connecticut, and it is worthy for the Public Health Committee to have that conversation. Representative Clara DeStitria.
Thank you, Mr. Chair. My question is on Senate Bill 683. I spoke to one of our local hospitals, and their question was, it restrict what? As of now, uninsured only pay the lowest contracted commercial rate or less if they qualify for free care based on their income. So the need for this, that's my question.
Well, I think we'll get to the merits of the bill when we have that opportunity in the public hearing. Does the person next to you also want to comment?
He's just happy he's getting his rubs. Thank you. No comment.
This is the part about Zoom hearings I love best, is we get to see everybody's pets. Senator Wong.
Thank you, Mr. Chair, and I will follow with my fellow rankings and my understanding and screening that it was going to be followed up with the proponent of this bill, and you would let us know. And I guess we were all very much surprised when it appeared on the agenda. So the concept of the bill, I completely agree, merits the discussion, whether in this committee or others, but we've been so honed down, so focused in this entire committee meeting on process. And this is just another example of the process not working on a fair and democratic basis. So I just simply wanted to point out the fact that we have a great working relationship in screening. I have the utmost respect for my colleagues and the chairs. But nevertheless, when we get out to the prime time, it seems sometimes the process goes one way. And perhaps that is why we're raising this question is we hate to tell our members in the caucus that, we didn't realize this was happening. And that is really not a good way for us to try to govern and truly respect when we talk about transparency and accountability. And that's why I think we're raising this question. And so I appreciate the issues we're discussing here, but it is about process, and it is about making an extra effort to make sure if we're having to be redundant, redundancy works a lot better in this day and age than saying, oh, I thought you knew. Thank you, Mr. Chair.
Well, thank you. I do believe there was legitimately some confusion based upon screening, but I'll add, Senator, that if you were confused or surprised by this, I would have appreciated hearing from you in advance of the hearing, rather than you're dropping this on us in the middle of the hearing. So I think it goes both ways.
Duly noted, and I appreciate that. And I guess we'll have to talk more.
There you go. Are there any other comments or questions? If not, I believe we're ready for the vote. Please, unless there are any objections, we'll do a voice vote. This is your chance, Senator Wong. Okay, going once, going twice. If not, make sure you've activated your cameras and unmuted yourselves so that we can do a voice vote. All those in favor of drafting items 2 and 3 under this section, please indicate by saying aye.
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 All those opposed? And I think that cat has voted. And there are no abstentions. We may now move on to the next item in our agenda. We are at item 6, proposed bills to be considered for change of reference action to Appropriation Committee. And the two items listed here, first item is Senate Bill 231, an act concerning the funding of municipal health departments and district departments of health. And the second, proposed House Bill 5398, an act concerning local health department or health district funding. I think you can see the word funding in both of these bills, which suggests that appropriations is the appropriate committee of cognizance. Do I have a motion to consider change of reference for these two items?
Representative Pettit, so moved.
Second.
Thank you. It's been moved and seconded. Do we have any comments or questions with reference to these two bills? Refreshingly, no. It's been moved and seconded. If there are no objections, we will move to a voice vote. Seeing none, please activate your cameras, unmute yourselves. We're all getting better at this. All those in favor of referring these bills to appropriations, please indicate by saying aye.
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 All those opposed? Any abstentions? We will now move on to the next item of our agenda. We're starting to build some momentum here. Item 7, proposed bill to be considered for change of reference action to the General Law Committee. There's one item, House Bill 5407, an act requiring the dispensing and administering of methadone to be reported through the Electronic Prescription Drug Monitoring Program.
Representative Pettit, so moved.
Do we have a second?
Second.
Yeah, are there any questions or discussion with regard to this item? If not, we will move to a voice vote unless there are any objections. Please activate your cameras, unmute yourselves. All those in favor of referring this bill to the General Law Committee indicate by saying aye.
Aye.
All those opposed? Any abstentions? We have concluded our agenda items. And again, to reiterate, we will be keeping the vote open for the next hour. Item 8 is the announcement of time and date of next meeting. We should all be aware that Monday, we have a public hearing starting at 9 a.m. They are mostly the items you will recall from the meeting that was snowed out, even though it was a Zoom call from last Monday, with one additional item. We will see you then. Any other comments or questions?
I would just add to that again, make sure if you weren't on at the beginning, make sure that you have the webinar invite for the 8th and for the 10th, our public hearings. And if you have not, please check the Health Committee and get that invite to yourself.
Thank you all for your patience and for your diligence today. And enjoy the weekend. We will hold the votes open for 1 hour.
Have a good weekend. Thanks.
Thank you. Goodbye, everyone.
Thank you. Thank you.
Senator Castro?
Yes. Hi, Beverly.
Hi, how are you? I
Fine.
think
How
you
are you?
missed the vote.
I did. So I wanted to vote yes.
Thank you.
Thank you.
Hey, Lindsay. This is Representative Parker. I think I missed the last 3 votes or so. I'm sorry, I was on another meeting that I had to, and I'm still trying to look over there. So can I just get my votes put in to say yes and hi, Beverly, to.
Hi, how are you? You missed 1 roll call vote. The
Okay.
other 2 were voice votes.
Okay, perfect.
So how would you like to vote on Senate Bill 568? No,
I'd like to
sorry,
vote-
not Senate Bill 568. Hold on.
I'd like to vote yes.
Okay. Thank you.
Thank you, folks. I'm all set for now.
You're all set.
Okay, thank you for your doing. Bye-bye.
Lindsay, we're waiting on Josh and Elliot and Haskell.
Yep.
Okay.
They'll-
So
they'll be
he
on-
was just voice votes.
No, I was missing them on 568.
Who, Parker?
No, Elliot and Haskell.
Yeah, that's what I'm saying. I missed them but Parker was voice vote.
Yeah.
Okay.
Lindsay? Or Beverly?
Hi, Senator.
Hey, how are you? I think I missed a vote or two. Is that right?
You missed a couple voice vote, but you missed the roll call on Senate Bill 568.
568. Could you remind me which one that is?
That is Senator, an act eliminating the non-medical exemption to the.
Oh, yes. I'd like to vote yes, please.
Okay, great. Thank you.
And in terms of the roll call, since I was in the meeting earlier, are those counted?
Yes, you're all set.
And not the roll call, I mean the voice vote.
The
Okay,
voice,
great.
yes, you're all set.
Thanks so much to both of you. Have a good day.
Thank you. You too.
Same to you. Bye. Hey, Lindsay?
Yep.
Do you want to take Representative Elliott's vote? I'm going to jump off so I can check registration.
Yep.
Okay, and just, thanks.
All right, what am I voting
All
on?
right. All right, so we're just missing one for you, SB 568, an act eliminating the non-medical exemption to the immunization requirement.
Can I vote yes twice?
All right, we got you. Thank you so much.
Got it, thank you.
Bye-bye.